we tried everything, but we ended up using lasers on this kiddo's brain, and the brain developed in a way that no one ever thought that it would. In fact, to the point that the neurologist that was overseeing the case actually thought that they misdiagnosed the child. So that was my first exposure to how transformative photobiomodulation can be and is.
Welcome to the Longevity Formula with Dr. Brandon Crawford. Let's explore the new era of wellness.
Hey everyone, thanks again for joining me at the Longevity Formula podcast. I'm super excited about this episode because I get to really talk about one of my absolute favorite topics, and that's the use of laser light therapy, otherwise known as photobiomodulation. This is definitely a love of mine. Now, it's been hard for me to kind of dial this back and deliver kind of the nuts and bolts or the beginning pieces of this. So what this will likely look like is a series of podcasts, because I want to get to the complexities and the intricacies of what really is going on when photons begin to interact with your body at the cellular level, but then at the atomic and subatomic level as well. However, we need to first lay some groundwork, right? So, if you're wondering if the power of light could be your key to healing, then this episode is for you. If this is your first time to tune in and listen and you're thinking, man, this guy's crazy, like this sounds like science fiction, you're healing stuff with light, well, this might be a little more captivating for you, and this might be a really good first exposure for you, because what I want to do is go through a lot of the evidence-based literature. I want to define and discuss some of the science behind laser and light therapy and photobiomodulation. And if you missed it, I actually first shared an experience that I had as an intern, and it was really what gave me the fuel and the passion that I have about using this modality in practice. So if you did not capture, or if you didn't catch that story, I do want you to go back and listen to my first episode, but I'll give you the abridged version right now. So basically, I was working with my mentor, Dr. John D'Onofrio, and we were treating a really complex case. It was actually a genetic brain disorder, and it was one that typically would not really progress. The person typically has several different types of disabilities, et cetera. The brain does not develop like it should. Long story short, we tried everything, but we ended up using lasers on this kiddo's brain, and the brain developed in a way that no one ever thought that it would. In fact, to the point that the neurologist that was overseeing the case actually thought that they misdiagnosed the child. So that was my first exposure to how transformative photobiomodulation can be and is. And like I said, it really just, lit a flame under me to really bring this to the world, and not only bring it, but let's talk about it and change it, and let's really figure out what's going on. Anyway, so that's what we've been doing. Not only that, but I've continued to be fueled because I am a clinician, right? I am in the trenches every day, and I get to witness what some people call miracles every day in practice. And that's so confirming for me that we are doing things right. We are on the leading edge. This thing called laser therapy, photobiomodulation, can have a dramatic impact on all sorts of disease states and conditions in several different regards. The scientific evidence supporting photobiomodulation is very robust. It really is, right? So red light therapy it has been gaining recognition, but it still isn't commonly sought after, especially in the more traditional or conventional settings. But like I said, the stories I get to see and witness every day, the miracles that we get to see every day, you can't ignore that, right? And so that's one of my big goals for the world, is to really open people's eyes to this. So what I want to do is focus on some of the more commonly asked questions that I get regarding laser and light therapy. So we really, kind of pared down and looked at some patterns in these questions that are coming through. So I hope that this is going to be informative for you. I think you're going to enjoy it. But first, how about a dad joke, right? So why did the photon pack its bags and move to a new city? because it wanted a change of light. All right. I'm hoping you're laughing. You're probably not, probably shaking your head, but that's okay. Okay. So what is the scientific evidence behind lasers? And that's a question that I'll have asked in multiple different ways. But basically, there are literally thousands of studies on photobiomodulation. You can trace this back all the way back to the 1960s. And what we need to understand is the type of studies that have been done. And so there's in vitro studies. And so in vitro studies are where you're doing this experiment on cells or some type of biological agent in a petri dish or in a test tube, right? It's outside of that normal biological context, if you will. Now, we need to understand, while these types of studies are so important, and just to be honest, I'm doing an in vitro study right now, right? So I'm not saying they're not important. They're very important. However, we need to acknowledge them for what they are. They are how cells are reacting outside of a human body or outside of an animal body. So we cannot always conclude that that is how cells will react inside the human body. When you have all of these innate responses going on and the complexity and the intricacies of the immune system and all of these things that are occurring within the human body, when you remove those cells and put them in a petri dish and apply light, we just need to consider that, right? We need to think through this. We also, one little side note, we need to consider the environment that we're also doing these tests in. So if we're testing the effects of light on cells, well, and we're doing it under fluorescent lighting, that fluorescent lighting is going to have an impact on those cells as well. And we know this, right? There's circadian biology research and literature that says that different wavelengths of light are going to influence cells differently. To date, no study has actually accounted for this. So that's one thing that we're going to do, because I do think that we will see different changes or we'll see different results. There are also animal studies in various regards, such as, you can find things for wound healing, inflammation, neurological disorders. And of course, there's hundreds of human clinical trials now that have been published. And that's important to note. And what I want to say is, again, there's hundreds of human clinical trials that are showing how safe and effective photobiomodulation is. It's very difficult to find that volume of literature for a drug. It just is. So that's one thing just to point out, is that this modality has been around for a very long time. It's been proven via research that it is safe and that it is effective. Now, there's also systematic reviews. There's meta-analysis that has been done. These are comprehensive reviews of existing literature. That's important to acknowledge. There's also case studies and case series. I don't want to not talk about those. In fact, we really need to acknowledge those along with pilot studies, because it's the case studies and the pilot studies are where we really see the innovative strategies happening, right? Like, we conducted our own pilot study in our office. I did not publish that data because it did have some intellectual property within it that I was not ready to disclose. But we need to understand that that data is important too. And that data is then what people in ourselves will take and then form the more involved human clinicals or animal models or whatever, right? So that's where it starts, are in those case studies and pilot studies. So again, just know what you're looking at, know what you're reading when you're looking at the literature, and please understand that you are not just a group of cells in a petri dish. You're just not. And I think if we can think through the literature like that, then we can definitely start to be on the same wavelength here as we digest the work and as we apply it clinically, right? Because dosing is important, right? And dosing is a big thing that you're going to see throughout the photobiomodulation research, where small doses have been preferred throughout the years. And there's several different things that I want to comment about that. I fully acknowledge that hormesis is a thing. the biphasic dose response curve obviously exists. This is a simple, or just a simple example is, small doses of something doesn't have enough benefit. There, you have just the right dose of something that works best, and then you can overdose on something, and that can lead to detrimental effects. This applies to everything. This applies to water, it applies to drugs, it applies to exercise, and of course it applies to photobiomodulation. My discussion around the hormetic curve and the biphasic dose response curve, which is a part of my intellectual property on this topic, is that we need to understand how to dose light appropriately for the person in front of us, rather than just simply referencing an article that says your dose is this, right? So that topic is one that we're going to dive into later, right? We're going to get into that in a different episode because I really want to dissect it and I want you to understand it better. So another question here is just simply, how do lasers work? So I get to talk about this in various regards. Yesterday, I had a really cool conversation with an 11-year-old boy. And this kiddo came in and he was struggling with a type of seizure disorder. And he asked me, like point blank, he just said, how are the lasers going to help my brain? And I thought, this is great because I don't really get to explain this on his level very often. And so I said, okay, imagine you have a Lamborghini. And we both acknowledge that that's one of the fastest cars made, and it's one of the best cars ever made. It's just fun to drive, and it's amazing, right? And he's absolutely, I want a Lambo. I said, great. Now, how fast does that Lamborghini go if it does not have any gas in the tank? And he was like, well, it doesn't go anywhere. And I said, exactly. So imagine your brain, and whenever you're having these seizure episodes, it's very energetically taxing. Now, just to kind of extrapolate here, right? So this is true for anything that's needing to heal. So whether you're healing from a traumatic brain injury, you're healing from a muscle injury, it doesn't matter, right? If you're healing, that area, that tissue has a higher energy demand, okay? So going back to my conversation with this 11-year-old, I said, okay, so now imagine you just need to drive your Lamborghini from home to school every day and back. And that's it. That's all you need to do. But because your brain is going through these seizures, it's more like your Lamborghini. You're taking your Lamborghini all the way up to Dallas and back 3 times every day before returning home. And I said, how much more fuel does that car need to drive from here to Dallas 3 times in a day versus here to your school? He was like, a lot. I'm like, absolutely. So you have to fill up that tank way more often. So that's how the lasers are going to help you. They're going to fill up your gas tank so that you can heal, so that your cells are more efficient, right? And that's, like I said, that's the 11-year-old boy version, which I think he actually comprehended. It was pretty cool. Now, of course, yes, it helps with cellular energy, which is a primary benefit that we need to acknowledge. It's going to speed up healing, obviously, by providing more cellular energy. It's kind of like charging the batteries in your cells, as another analogy. And so basically what it's going to do is it's going to reduce swelling, it's going to reduce pain, it's going to help repair damaged tissues, but it's going to help that occur more effectively, more efficiently. And that's the thing. Anything that needs to happen in your body by applying photobiomodulation, it's going to happen better. It's going to be more efficient in whatever needs to happen. So again, whether it needs to make a neurotransmitter or it needs to heal a bone or a muscle, whatever, if you apply the appropriate parameters of laser and light therapy, it's going to do that more effectively, right? So a few key mechanisms, right? You have to have cellular absorption, right? And this is the first law of photobiology, if you will, is that there has to be something to absorb that photon. Otherwise, obviously, it's not going to work. Now, this comes to a discussion around how certain wavelengths of light are absorbed differently by our cells. And think about it like you have solar panels all over your body, on every single cell in your body. And you do. These solar panels are called chromophores. And there's even other types of solar panels, if you will, that are being uncovered and still being discovered. But essentially, that's what's going on, is that these photons first have to be absorbed at the cellular level, and then they start inducing change. And that's a photochemical change or a photomolecular change, right? So there first has to be an initiation at the cellular level there. And then what's very well noted in the literature is that we get a stimulation of mitochondrial activity, right? So you have this component of your cell called the mitochondria, and most people have learned about this in biology class as the powerhouse of the cell, right? This is where the cellular energy is made, and that's true. Within the mitochondria, it has the electron transport chain, and it does exactly what the name says. It transports electrons through a series of complexes and ultimately terminates with the production of ATP. And ATP is the fuel for your cell. What many people don't understand is that ATP is not the only byproduct of this process. You also get water, which is a special type of water called exclusion zone water. You also produce carbon dioxide during this process. We'll talk about that more in depth, again, when we talk about more of the complexities to this process. So again, you get stimulation of mitochondria, and there's so many things to talk about there. Mitochondrial health is really, really, really the leading discussion right now, whether you're in the health and longevity field or you're talking about healing brain injury or even genetic disorders. Everything is really coming down to this cellular mitochondrial discussion. Even in functional neurology, these are the discussions that I'm going into and that I'm thinking through when I have a very complex case in front of me. So you get a reduction of oxidative stress as well. So photobiomodulation can increase the production of antioxidants within cells, which is cool, right? So we all know about antioxidants, things like vitamin C and vitamin E and stuff like this. But photobiomodulation can actually increase the production of these antioxidants endogenously within our cells. So obviously, oxidative stress is a condition characterized by an imbalance between the production of free radicals and the ability of the body to counteract their harmful effects. So if we have too much oxidation, then that can lead to cellular damage. Okay, that's kind of the bottom line. And photobiomodulation will come in and clean that stuff up and help us to recover faster. We have enhanced cell proliferation and migration, which is really important, especially if we're talking about stem cells, which is very, very important to acknowledge. So basically, as we offload the oxidative stress, like we were just talking about, what's going to happen is you will see an enhancement of this cell proliferation, meaning a cell is going to grow, replicate, multiply, and do what it needs to do, again, to replace those damaged cells, right? So it's going to increase that cellular proliferation. And, just from a stem cell perspective, again, we'll get into this in the later podcasts, but I was able to speak with Dr. Todd Ovakaitis about the V-cell procedure that he's actually developed. And he was telling me about the initial pilot study research that he was doing, where he actually measured the V cells in the plasma, which he consistently measured to be between 10 and 20 million. And then after applying the type of laser that we use in this procedure, it actually increased that cell count to 60 to 80 million very consistently. And that's where, again, you see this increased cell proliferation and whatnot, right? And so you can see this in the body too, obviously, right? And so, again, we'll get into that more in later episodes. And you also have this anti-inflammatory effect that is noted very consistently across all the research. This is important to understand that, yes, you have a decrease in inflammation, and that's probably how most lay people are going to have this discussion. However, what I want to acknowledge is that really what's going on is a modulation of inflammation, because you will see things like, for example, off the top of my head, you have things like NF-kappa B. Okay, NF-kappa B can be pro-inflammatory if you have too much of it. Well, it's a double-edged sword. You have to have NF-kappa B in order to promote neuroplasticity. Okay, so we know that's true. Here's the cool thing about laser and light therapy. It's the great regulator. So if you need more of a certain inflammatory cytokine, you'll see an increase in that inflammatory cytokine. If you need less of a cytokine or inflammatory marker, it will go down. So photobiomodulation consistently through research has been noted to regulate these systems and these cellular markers, right? So that's one thing to really understand. So it's again, its safety profile is amazing. Pain reduction, obviously, lots of information showing that photobiomodulation absolutely can reduce pain. It does this by the release of things like endorphins. These are chemicals inside your body that just naturally block pain. There's even studies done that show sunbathing actually causes an increase in endorphins, opiates that actually can help block pain. Now, obviously, we leverage the wavelengths of light that help to do that better, but it's very well acknowledged that we do get this endorphin effect to help to reduce pain across. It doesn't matter what type of pain, just to be honest. We can talk about CRPS, we can talk about acute pain, we can talk about all types of different things. We will see this production of endorphins. Laser therapy, photobiomodulation is going to have a huge influence on blood flow. Most people are going to discuss it as increasing blood flow. And so, a question that I often get asked, because again, I'm in the brain space, I'm in the neurology world, and a lot of people coming to me have brain injuries. They will say, well, should I use laser therapy after a brain injury because it increases blood flow? And I'll say, well, first of all, we do have studies that show and recommend that for mild to moderate brain injury, it is suggested to use photobiomodulation as a primary modality for brain injury. So, number one, that has been suggested in the research. But number two is that, again, this is going to regulate blood flow. It's going to modulate blood flow. Okay. Laser therapy is the great modulator, it's the great regulator. So obviously, if you know that there's an active bleed going on, then perhaps we don't want to use it then. In all of these situations, of course, consult with your medical team. That's always of utmost importance. Don't take this as medical advice, but we need to understand that laser therapy will modulate blood flow, whether in the body or in the brain. Okay. And then we get stimulation of tissue regeneration. So it's happening here, right? So we're enhancing cellular function, we're reducing inflammation, we're promoting the regeneration of damaged tissues. This includes skin, this includes muscles, nerves, bones, you name it, right? So by doing all of these things, right? And again, this is the tip of the iceberg. By doing all of these things, by simply using some form of photobiomodulation, we are enhancing this tissue regenerating effect, which has a huge implication with healing for anything, again, any condition, but then also health and longevity, right? Let's just take a little step back, right? Because I use laser and light therapy almost daily, right? If I'm super crazy busy and I forget, then I forget. But the majority of the time, okay, I am using some form of laser and light therapy every single day on myself while I'm driving into work. I'm using our laser on my brain to wake it up. I'll typically be using a beta wave, right? I'm pulsing a beta wave frequency into my brain because photoneuromodulation is a thing. You can actually induce brain waves by how you pulse the light. We do that clinically every single day. We absolutely see how it changes EEGs. We see how it changes the brain. So while I'm driving in, I'm preparing my brain. At night, I'm laying under my LED panel. On the weekend, I'm doing the panel, I'm doing the laser, I'm doing all the things, right? So every single day I'm using it. I'm doing it to promote health and longevity. So it's not just something that needs to be used for someone for a condition or a disease process or whatever. I also want you to understand that light therapy is treat it like a nutrient, right? So photobiomodulation is congruent with nutrition. Your cells need light. Think of it like a nutrient. You need your daily supply of photons, right? Very important, right? So another question we get asked often, why do lasers work so much faster in medical applications, right? Well, that's an interesting question. Let's answer it like this. So lasers deliver this concentrated light energy directly to the targeted area, okay, allowing for precise and efficient treatment. So there's several different things to talk about here. So we have the high intensity of the laser therapy, right? So lasers, like I said, are going to produce this higher intensity beam of light that can penetrate deeper into tissues compared to non-coherent light sources, enabling them to affect cells and tissues quickly at a deeper level. We have this concept of precise targeting. Okay. So think of it like this. If you take a drug, which I'm not saying to not, but I'm just saying if you take a drug, that's going to have a very widespread effect on the body. It's going to affect everything. With lasers, we can actually precisely target certain areas, whether it's a small area, we can cover a big area. We can be much more specific with how we target the body, right? So obviously, this is going to minimize impact on the surrounding tissues. This is going to really help you heal faster again, right? And we have a direct stimulation on cellular processes. Again, if I go back to, this discussion on drugs, and again, I'm not talking about drugs in a negative light. I'm just trying to explain this in a way that people are familiar with. But let's say you have a headache, right? It's not necessarily because you have an Advil deficiency. However, you may have a light deficiency, or maybe you were overexposed to the wrong wavelength of light, or maybe that an area of your brain needed more blood flow, or maybe there's an area in your brain or nervous system that was inflamed, right? Well, now we can have this discussion. Photobiomodulation is going to directly supply what that area needed. So if it was blood flow, great, it's going to modulate it. If it was inflamed, it's going to reduce it. If it needed a neurotransmitter, well, it gave energy to the neuron so it can produce a neurotransmitter, right? So we actually start to get this direct stimulation of cellular processes that can actually get to the root of the problem rather than dancing around it and creating side effects and doing all of these other things. And again, you do see immediate biochemical effects. This is noted in every single research study. So the light, right, from these lasers are going to have an immediate impact on biological tissue. It's going to trigger biochemical changes at the cellular level without the need for metabolic conversion or systemic circulation. Again, if you're taking something, drug, medication, whatever, this has to be metabolized. So it has to go through the digestive system, has to go through the liver or the kidneys, has to be metabolized. And then you have, right, all these series of events that has to happen so that that has an effect on the body, right? Well, with photobiomodulation, there's an immediate effect, right? You get to directly influence these cells. And again, you get minimized inflammation and pain rather quickly. You're going to very quickly reduce inflammation. You're going to very quickly upregulate endorphins to block pain. You're going to very quickly upregulate cellular energy so they can heal faster, right? And it does have this enhancement of circulation, right? So we need blood to deliver other nutrients, other growth factors, other things to the targeted area, right? So we do have this effect on blood flow like we talked about earlier. So of course, this is going to speed up the healing process. Okay, next question. So how many treatments does it take before there's a noticeable change? It's not always a very black and white answer. Unfortunately, I don't have a magic crystal ball. So, and please remember that I see people from all over the world with some of the most complex neurological disorders you can think of. In fact, just yesterday, it was fun because I got to work with one of our local patients that was coming in, not a severe case. I typically don't work with those types of patients just because I'm typically working with the really severe ones. But I got to work with her and I was like, just going right in, just, working with her. I had to balance some things and work on, I was like, oh my gosh, I forgot how quickly like a quote, normal functioning human actually responds. It was like, bam, change that, bam, change that. And I was like, oh, this is awesome. I remember these days. So here's what I'll tell you. Typically, you are going to see a change quickly. Okay. But again, very much depends. I've even had people come up to me after I lectured somewhere. I got a conference and they would say like, I've had this knee condition for years. Can you laser my knee? And we lasered the knee and then they would follow up like a week later, two weeks later and say, oh my gosh, from that one application, I can definitely tell a difference. So we can absolutely see very fast responses and we do see very fast responses. But please understand that it also depends on the device that you're using because the laser beam that is produced will have different effects, right? We'll talk about that a little bit more later, but we do need to understand that not all lasers and not all devices are created equally, and that not all laser beams are created equally. And that's really where we see the big differences. I've always made the statement, a photon is a photon, period. And that is true, but we have other parameters to consider. How are we delivering that photon? How is that photon interacting and communicating with the body, right? So we're going to talk about that. But, just for, a cleaner answer here. So we're for acute conditions, muscle strains, minor injuries, post-surgical healing, noticeable improvements will probably be observed just after like even one application or just a few, right? That's very common. The more chronic the condition is, so like degenerative disorders, arthritis, chronic pain disorders, long-standing skin issues, obviously it's going to require more therapy. There's more healing that needs to take place. Sometimes this will range anywhere from several weeks to months, maybe even just consistent application over a year's time, right? So we need to remember that for these chronic conditions, these did not develop overnight. We might have to reverse 10 years, 20 years, 30 years of an adverse biological process. So that might take time to unfold. We need to understand that. Again, just going into this concept of we're actually getting to the root cause here. We're actually helping the cell heal itself. We're just helping that cell do what it's supposed to do better, right? So there might be several decades to back up and really address, or, maybe this will happen very quickly because this hasn't been going on for very long. Frequency and duration of application is very important. So, when you think about this, some conditions, again, maybe we need daily applications. Again, for my own health and longevity benefit, I'm using photobiomodulation daily. I am, but it's because I understand the benefit. I understand that I need to charge my batteries. I understand that I am a Lamborghini driving to Dallas, 5 times every day, although sometimes I feel more like a Pinto, but I have to fill up my gas tank, right? So that I can be my best self. So frequency and duration does matter. And this is why I do like people to have a photobiomodulation device at home. I love lasers. Lasers are different than LEDs, and we'll talk about it. But I think having a home laser is so beneficial, again, because that daily application, whether it's for a condition or for health and longevity purposes, it's just a good idea, and the literature supports it. Obviously, everyone is going to have individual variability. We all respond differently to things. We all respond differently to drugs and medication and exercise and all the things. It's the same thing with photobiomodulation. However, I have seen reduced variance in people. And I think it's because this is such a basic need that we all have to have, that everyone needs it. And yes, some people are going to respond faster than others, but everybody responds. I know that's a bold statement to make, but everybody responds because, again, this is a nutrient that your body has to have. And if you're depleted of this nutrient, you won't heal as effectively as you would otherwise. So, but yes, there is individual variability, of course, in how fast someone may heal, right? So, how many treatments are recommended? Gosh, such a variable answer. Okay, so this will kind of piggyback on what I was just talking about. And let's compare it to flossing in the dental world, okay? If you floss your teeth once a week or once a month or once a quarter or once a year, right? You're not going to really have the benefit of flossing your teeth, right? But if you make something a daily habit, or shoot, even an every other day habit, there's a much different outcome, right? So if you floss your teeth, let's just even say every other day during the week, I don't think there's a dentist on the planet that would argue and say that you're not going to have better dental health than if you only flossed once a month. Okay. So we need to think about this the same way when it comes to photobiomodulation. Your cells need certain types of photons every single day. Your brain needs it. Your organs need it. Everything in your body needs it. So why not give it to them? right? This is something that has to happen. So, how many treatments are recommended? Such a hard question to answer, but hopefully I gave you at least a little bit of information there to digest. Is there such a thing as overdose? And what are the side effects? Okay. Now, obviously, eye damage is top of mind. The retina is the most sensitive tissue in the body to light for obvious reasons. And so, when we're looking at laser safety, everything is based on how many photons can fit through a certain aperture or a certain hole, right? That's the size of your pupil from 100 millimeters away, and it's a 7 millimeter aperture. I only know this again because I've developed lasers and I've developed some really cool lasers, but we had to think through this and understand how laser safety works and why it works in the way it does. So eye damage is top of mind. What's interesting, right? So we mainly use class 3B lasers. We've actually developed class R, 3R lasers. Class 3R lasers do not require eye protection. And again, it's because of what I just mentioned, how many photons are going through a certain size hole from a certain distance away, replicating the eye. That was important to me because that's a constraint on medical practices when everyone in the room has to be wearing laser safety glasses. So we wanted to create a laser that was a class 3R. However, I wanted to make a laser that is more powerful than our 3B laser that we're using right now. And we did it. And here's the thing. You will hear practitioners out there that say anything above 500 milliwatts is a class 4 laser. Well, on average, that's true. And if that's all that you know is just how to read a power rating and convert it to safety class, then that's all you know. However, if you understand laser beam physics, you would then understand that we can craft a laser beam in such a way that it actually maintains a safety rating of a class 3R. However, we have the power of a class 4. So it's a class 4 power with the safety of a class 3R. And that's what we've made. I will get into that more, but I'm just kind of alluding to this whole safety concept, right? So overdose, right? Now, beyond the eyes, the next topic to really talk through is this concept of thermal damage and cellular damage. Now, this goes back to this concept of the biphasic dose response curve and hormesis. Yes, if you use a laser too much, it can cause damage. Clearly, okay? We know that. Now, what I'm arguing is if you're sick, right? Let's say that you have the cold or you have a flu, you require more nutrients. Maybe you need to hydrate more, you need more of a certain nutrient, you need to, improve your nutrition, whatever it may be, right? Your nutritional demands, your energetic demands at the cellular level changed because you have a cold or flu. Okay, we know that to be true. Now, that means your hermetic curve, your biphasic dose response curve to those nutrients, in fact, was altered. Okay, so now if I have someone that has a brain injury, or if I have someone that, we're trying to repair a liver or whatever it may be, is it not a far reach to then say the hermetic curve for that damaged tissue was changed based on the needs, based on the energetic demand? I don't think that's a far reach at all. In fact, now we can apply this in other ways too. And again, this is part of my IP, and it's this concept of co-activation. So again, going back to that Lamborghini, if I really punch the gas and I'm just speeding down the highway at 150 miles an hour or however fast Lamborghinis go, I'm going to use more gas. Yes, absolutely, that's true. Now, if I'm rehabbing the brain, let's say I'm stimulating a part of the cerebellum, I'm doing vibration, I'm doing, different types of joint movements, I'm doing an exercise, whatever. It's like me pushing the gas on that Lamborghini. I'm using up more fuel in the cells in the specific part of the neurology. Therefore, it has a higher energy demand. Therefore, the hormetic curve changed. The need in that area changed. These are the things that are not currently being accounted for in the literature. And this is the reason why I need people to understand what I'm talking about, because people are taking a stance, and I consider it dogma, where if you exceed a certain dose, you're going to cause harm. but you're not even factoring in something that I think is just such common sense. But apparently it's not just common sense. And I've had many arrows stabbed in my back because of this. But I will tell you, if it didn't work and if it wasn't true, then we wouldn't have these people recovering the way that they are. We wouldn't have someone who couldn't speak over here and now they're telling us a story. And we wouldn't have people that couldn't walk when they first came to us and now they are. And they're not only walking, but running, or they're doing whatever they need to do, right? These transformations wouldn't be happening if I truly were exceeding hormetic threat. I hope we understand that. Okay. So again, how do we monitor this? Okay. Now, our skin has a mechanism in it. So if you were to go spend too much time in the sun, obviously your skin starts to turn kind of pink, gets kind of splotchy, and then you start to develop a sunburn. So we have these natural barriers that tend to tell. I'm not telling you that's the only way to monitor. Okay. I'm just giving one example. So obviously if we use, even when I use my LED panel, I put it as close to my body as possible. And if I start to feel that tingling, like that burning feeling, I'm like, okay, I'm starting to get too much, and I'll back it off or I'll reduce my time. If I get out from under that thing and I've got just all this red splotchy, look to me, I'm like, okay, that was a little too long. Again, that's just one thing to monitor. We also monitor heart rate. We monitor oxygen saturation. If your oxygen, especially if you're using it on the brain, if your oxygen saturation starts to go down, then you're starting to exceed the hormetic curve. If your heart rate starts to go up, especially by about 10 beats per minute, then you're starting to exceed that hormetic curve, right? So what I'm saying is we need to be monitoring our patients and ourselves when we're using photobiomodulation, and we need to try and ascertain what is best for that individual, what is best for ourselves. I think it's very important to work with your caregiver, to work with your doctor, your provider, whoever you're with, to help answer this question for you. These are just some of my initial conversations I wanted to have. Again, I want to dive really deep into this, again, because it is the core of my IP that I really want the world to understand. Okay, so how do you choose the locations to point the laser at, right? Good question. Sometimes it's very obvious. I have a hurt knee, I laser my knee. I have a headache, I go to the point on the head. However, headache's a good example. One of the best strategies that I've used for headaches is actually lasering the carotid arteries and the vertebral arteries, because that changes how the blood flows into the brain. You get all of these great anti-inflammatory effects. You still get an increase in growth factors because of the secondary and tertiary effects from using the laser over those areas. So sometimes we choose the area that we want to laser based on blood flow. So let's take an example of someone wearing a cast. So I broke my arm and I have a cast. Well, the break is here in the middle of my forearm, but I'm wearing a cast. And if I shine a laser over the cast, I don't care what anyone tells you, you're going to have an attenuation of photons. The majority are not going to reach the skin. Will there be a few? Yeah, there will be, but the majority of them, no. But what if I go upstream and I laser an artery that flows into that region? This is a concept known as blood illumination. This is something I found many years ago out of the Russian literature. And those crazy Russians, they did not always publish the research, but I found this, I think I actually found it in a textbook, in a Russian textbook, where they were using blood illumination to affect downstream body parts. So sometimes we actually do this so that we have this downstream influence, and there's several different reasons why we would do that. Sometimes we're going to laser an acupuncture meridian. There's really interesting studies done on laser acupuncture. You can sometimes stimulate an acupuncture point faster and more efficiently with a laser than with a needle. So that's important to acknowledge and understand. So how we choose these points are very much based on the outcomes that we want to derive. I think that's a great place to go ahead and wrap up this part one, right? So in part two, we're going to dive back into some of these most commonly asked questions. I want to continue leading you down this journey of understanding the nuts and bolts, the foundation of this amazing modality that we call photobiomodulation, this laser and light therapy, and how this can truly have a transformative impact on you, on the people around you. And then what I want to do also in part 2 is I want to introduce you to something that I've been working on for the past year and a half. We have some amazing and exciting new developments. I've been alluding to it for a long time now, but I'm going to tell you a little bit more about what that development is next time. So please, please, please come back for part 2. I can't wait for it to release next time.
We hope today's episode has inspired you to take that next step toward your best self. Remember, the path to longevity is paved with small, daily decisions. Your journey is unique, and every step, every choice, brings you closer to your ultimate vision of a healthier, happier life. For more insights, tips, and resources, visit drbrandоncrawford.com.